Well, good morning, Mark. It's great to have an opportunity to catch up with what's happening at Grace Clinic. You know, healthcare has been in turmoil for many years, and COVID's added another whole layer of complexity to both coverage and access to care. And in our community, Grace Clinic is at the heart, the core of serving people who have lost their insurance or who have no longer have access. I just saw a report from the state's Office of Financial Management yesterday, and there has been a 23% in uninsured adults pre-COVID to now in Benton County, and about a 4% in Benton County and Franklin County. But Franklin County was already at nearly 16%. That is more than almost 40,000, I think, adults who don't have health insurance, and yet health needs don't stop. So give me a little glimpse of how has the demand or need for Grace Clinic services changed as a result of COVID, and just frame that with who do you serve?
Well, we serve people who are low-income, uninsured residents of Benton and Franklin counties. We include Burbank in there as well. It's kind of part of the greater Tri-Cities, but outside of Franklin County. So that's the group that we serve. And within that population, our patients really predominantly are working age adults, because kids are eligible to be covered by the state. So there are virtually no uninsured kids. And most people who are over 65 are covered by Medicare. So, we're really talking about a working age population. And these people are, pre-COVID, most of them were working. Some of them, less of them are working. But, they all work in low-wage jobs for employers that don't provide health insurance. And now in the COVID reality, a lot of people have lost their jobs, and with it, their health insurance. So as you noted, the state has put out some data on the increase in uninsured, and that increase is significant in our community.
One of the things I so appreciate actually, there are a bunch of things I appreciate about Grace Clinic. First and foremost, that it is a lean but not mean machine, meaning that you are Grace, you yourself are a volunteer executive director and use volunteers in providing services. The medical providers, by and large, are volunteers who come from the region. So it is the most cost-effective way of meeting healthcare services. But that in and of itself has been changed too, because volunteers have other things that medical professionals, their time might be absorbed being an essential worker. Others may have health concerns of coming and volunteering in the clinic just because they want to minimize exposure. And I'm confident that your cost basis, things you need to cover, like extra cleaning, things have gone up. What's the biggest challenge that you've faced and are seeing ahead for Grace Clinic?
It's been a really interesting 6 months. And unlike many free clinics in the state, we continue to operate throughout this. A lot of them shut down. And we actually consider ourselves to be fortunate having continued to operate, because we were able to tweak as we went along, as opposed to somebody who'd been operating one day, closed, and 6 months later is trying to get restarted, and everything is different. So, there are very few days where we're not tweaking something, and there's certainly no weeks when we're not tweaking something. And as you said, we rely very heavily on volunteers. But at the present, for the most part, we're not using non-clinical volunteers because many of them are older and therefore at greater risk. We're looking to minimize the risk for everybody, for our patients, for our volunteers, for our staff. And so, we were fortunate. We got a grant through the National Free Clinic Association that allowed us to hire a full-time receptionist, because previously, reception was all volunteers, and the vast majority of them were older women who, carry greater risk today. So, we've had to make a lot of changes, and, we've had to increase what we spend on cleaning the facility. We've had to We have increased demand for PPE. We've had to make some physical changes to the facility. And early on, we launched using telemedicine, which is a good solution, but not for some things and not for some of our patients. Because we deal with a low income population, similar to what people have heard around issues with school children not having reliable access to internet, that poses a challenge in conducting telemedicine. Okay, so for some of our patients that's not an option, but it's one of those things that we did to try and do the best job of meeting the need while keeping people as safe as possible. And early on, and this is still to some degree today, people are reluctant to go for things that maybe they can wait on. Now, we actually, in looking at the first 6 months of the year, one of the things that we discovered, to our pleasant surprise, was that our patients with chronic disease, with diabetes being the largest group of those people didn't reduce their visits. And them being seen regularly is a key component of helping them manage their disease successfully. So, where we've seen some changes is in the more kind of general medical needs. But what we've also started to see very recently is the impact of the uptick in uninsured. We've had a substantial number of new patients in the last month who are recently uninsured. And that volume is only going to continue.